Welcome to AXREM Insights, developing healthcare through medtech and innovation. Join Melanie Johnson and Sally Edgington as they talk with our industry leaders and experts.
Hello, I'm Melanie Johnson and I'm here with Sally Edgington. Welcome to episode 3 of our Collaborations podcasts. Today we have the pleasure to be speaking to Jacqui Rock, Chief Commercial Officer at NHS England. Welcome, Jacqui. Thank you for being on the show and allowing us to get to know you a little better. With our podcast theme being collaborations, I will start by handing over to you to tell us a little bit about yourself.
No, thank you very much. And I'm absolutely delighted to be here today. Thank you for inviting me. So my name is Jacqui Rock. I'm the Chief Commercial Officer for NHS England. And just a little bit of my sort of backstory. So I spent over 35 years in both public and private sector. I spent the first sort of 28 years of my career actually in investment banking. Then I joined the government. And in the government, I've worked for various ministries, Ministry of Defence, Cabinet Office, and now the NHS. So it's been really varied. I've done a lot of things. I've been really privileged in my career, especially in my banking side of my career. I've managed to live in multiple global locations. And I think that diverse range of experience kind of makes you the leader you are. And, you know, people often say to me, how did you get into these sort of government procurement jobs or government commercial jobs? And a lot of people use the narrative, oh, I fell into procurement or I fell into commercial. I really didn't fall into it. I was very, it was very planned, and it was at least 20 years ago that I made the decision that this was the area that I wanted to get into. So here I am today.
Excellent. So why did you make that decision, Jacqui?
Why did I make the decision to move into government or into
within the NHS? Yeah.
Oh, well, the NHS. Well, that's really interesting because people often say to me, oh my goodness, you're so long in financial services. And I was getting to my late 40s and just coming up for my 50th birthday, actually. And I realised that I'd spent the whole of my career in financial services, and there was a real danger of getting pigeonholed and not having done anything else other than financial services. And I was already working, and I'd encourage everybody to work very closely with the government, lots of think tanks, lots of alumni groups. So that is when, you know, when I first sort of thought, well, I'm actually going to change, do exactly the same thing that I'm doing in terms of my professionalism of supply chain, but actually go off into the government and try something different. And I went into the Ministry of Defence and made, you know, that there was no turning back from then. And then COVID hit, and that's when I moved from defence into health. And again, there's so much to do in health. There's so many opportunities. The significant impact that good commercial and procurement practices have on the health of our nation. It's somewhere I just needed to be.
Fantastic. And Jacqui, it's clear to see that you're very driven and you want to bring about positive change in the NHS. So I just wonder why you're passionate about this and what change have you driven so far?
All of us that sort of live in this country, most of us, you know, from cradle to grave, you know, we were born and we will depart this mortal coil with the NHS by our side. So it is an organisation, I know, not just those of us that work in the NHS, but actually the whole of the British population feel very, very passionate about. It's our mission to ensure it's efficient, to ensure there's value for taxpayers, and obviously to make sure that we create an NHS that's fit for the future. And as you will all know, we've just had the recent Darcy review on the state of the NHS, and it's a very, very good read. I'd encourage people to go and have a look at that. It's quite it's an easy read, so it's worth looking at. And so now we've got the diagnosis. It's really time to work on the prescription and what we need to do about this. And as I say, I feel absolutely passionate that our procurement, supply chain and commercial practices are absolutely key to delivering this NHS reform over the next 10 years. You know, the reform plan is a bold agenda that's being created, and there are 3 really big shifts, which I'll just reiterate again. Hospital to community, analog to digital, and sickness to prevention. And in each of those big 3 shifts, commercial play a massive part.
Absolutely. And I think as well, the reason that we're all invested in this is because we're all patients ourselves and our families. And I think that's just so important. And I think that's when you can kind of, you know, see why we all work in the sectors that we do, because we are really passionate about it. In terms of your kind of key priorities, what will you be looking at kind of moving forward, Jacqui?
Yeah, there's a lot, and as I said, we were already on a very, very clear pathway and reform of the commercial practices across the NHS. So the review and the new NHS reform, it's very much aligned. So a couple of things. So first of all, I'll talk quite high level. For us to deliver this NHS of the future, we need a real clear strategic approach to supply chain transformation that everybody in the health setting signs up for. So whether it's in primary care, so your GPs, dentistry, whether it's in secondary care, whether it's in social care, we all need to be very, very clearly aligned. I really believe that there needs to be a shift in mindset and perspective that the role that supply chain brings, and how great, excellent, world-class procurement, how it can change a company in terms of productivity. And one of the things I'm very vocal about is changing the language that we use, changing the narrative. We need to use the language that is used in the executive boards. We need to use the language that is used on the front line. So when we're talking about procurement, we're talking about our supply chain and how it can improve the quality of service and deliver savings and generate profit, etc. So that can go back to patient care. We use the right language in terms of productivity. So some of my key priorities, I've got about 5 key shifts that I think need to happen. And if you bear with me, I'll run through them quite high level. So first of all, work around influence and scale. As I said, the NHS, we are the largest government spend. It's over 30 billion. And if you look at the entire health family, it's over 90 billion of spend. So we have got a massive responsibility and commitment to ensure that we leverage that spend. We strengthen the partnerships. We foster healthy supplier markets. We've got to work better at buying together. Second thing, we've got the new Procurement Act coming. It's been a little bit delayed, but it's going to come in February 2025. And that's going to give us the opportunity to totally transform how we buy, not only in the NHS, but right across government. So all government buying. And that's a really, really exciting shift that we need to leverage. The third thing, we've just introduced a new strategic framework for NHS commercial. Now, I was talking earlier about how, kind of all for one for all. So this framework is going to outline for the next 5 years, and we've got 26 key interventions, which is incredibly exciting. Fourth big shift, digital and transparency. We must digitalise. As I say, that was one of the big 3 main deliverables from our Secretary of State and the Prime Minister, analog to digital. We've got to digitalise the NHS. And so, and we've got to buy that digital capability. So whether it's AI and medtech, whether it's how we use data, there's an entire program and architecture around digitalisation. And then finally, workforce development. So important. It's often, we've got to attract and we've got to develop and we've got to retain the best people. But I'm really, really serious about this. And we've got lots of programs and schemes, because I want the NHS to be somewhere that procurement, commercial specialists and people starting out in their career, they see this as a great place to come and work.
Yeah, and just going back to your digital and transparency, one of the things that our members have concern around is cybersecurity, and it's one of our strategic priorities. And I note, and maybe I missed it, but I read all 163 pages of Lord Darcy's report, and I didn't see one mention of cybersecurity, which was slightly concerning, because I feel like that's one of the very big threats to the NHS. So I just wonder, in that digital and transparency, is there any work going on in terms of cybersecurity, and kind of, are you able to give kind of a high level view of that?
Absolutely. And, when we look at Lord Darcy's report, there, again, he had to keep a report. And so he kind of worked on the sort of the big challenges and the clinical pathways. But there is so much data as well behind that. And there is a whole report on cybersecurity. We've got absolutely a key focus. You'll remember what happened earlier on in the year in terms of data breaches, and how, it literally, from sort of blood and testing, how it brought certain trusts, really, really affected patient care. So we're very, very focused on it. And there is a lot of work, and I have a dedicated team within commercial that are specialised in buying, purchasing, putting deal agreements in place for cyber security. But I mean, just sort of taking a step back, the whole AI, medtech, digital transformation. The NHS, we spend over 10 billion a year on medtech. I mean, it's a huge amount of spend right across right across all of the different categories. And of course, AXREM members, really at the forefront of this. So we've got to make sure when we're looking at that digital and technology spend, what we're doing already, and it was in your 25-27 strategy, very, very clear in terms of, digital and transformation. And I did check, and that totally aligns with the NHS commercial strategy and how we use technology to influence and deliver patient outcomes. I think it's absolutely totally aligned.
Super. So how do you think industry can help with your key priorities, and what value do you think trade associations can offer to drive this change?
Yeah, I mean, innovation, right, is part of the solution, and how quick we get innovation in. And so much of that comes through the trade bodies, the innovation, the consultation, the council, the ability to work with the market through a trade body is so important to me. So what I would say for the association is encourage your members in a few things. First of all, encourage your members to be ready for the new Procurement Act. If they haven't read it already, I'd encourage people to go onto the government website. There's a really one of the best sort of quick education programs I've seen, actually. So just on .gov.uk, if you put in Procurement Act, there are videos, like 10-minute videos, depending on who you are, whether you're a current supplier into the NHS, whether you want to become a supplier into the S, whether you're an NHS worker, and it literally explains everything you need to know. And then it can lead on to longer term, because it is going to give us, the Procurement Act is going to give us a huge opportunity. If we get this right together as an NHS and public sector organisations, along with the suppliers, to fundamentally change how we buy, speed things up, go quicker, more innovation, more focus on SMEs, more focus on transparency and pipeline. So please encourage your members to really get up to speed on the Procurement Act. Another area is, which we haven't touched on yet, is the sort of the sustainability and the net zero. Please encourage your members to engage with our NHS supplier roadmap and our Sustainable Supplier Forum. That's something you already are doing, and we really appreciate your help on that. And there's lots of tools. Again, you go onto the website, lots of tools, lots of assessments that people can get involved in. And I would also say encourage your members to continue to work with my commercial teams, not only just in NHS England, but right across the NHS. We've got a much more structured engagement than we've ever had before with trade bodies since we first announced the inception of the NHS Central Commercial Function, which is a central function that all of the 4,000 plus commercial community are now part of. So I think, it's been a long time since our suppliers and our trade bodies had a seat at the table, but you've got that now, got that opportunity. We do have lots and lots of conversations. Let's make sure we keep that relationship going. Make sure you keep challenging us. We make sure we still keep working on the joint initiatives that we want to do. So it really is. It's something that's evolved over the last couple of years and seems to be really working very, very well.
Yeah, I agree. And I've actually seen loads of positive change since you've been in post in terms of your engagement with the trade associations, with the annual event that you've held. We were up in Leeds earlier this year, and it was a really interesting day for myself and the members. And just to feedback in terms of kind of our members' visibility in terms of the new Procurement Act, we've just run a webinar on that, and we will share those video links so that we make sure members have got that in our next newsletter. But we've been putting lots of information back to members. And the sustainability and net zero, we have a really, really active special focus group, which is led by one of our members. And we also have the lead of sustainability from NHSE within that group, and the lead from NHS supply chain. So it's a real collaboration, and it's proving, really useful. So we're always happy to engage. And I know Alexandra Hammond, who sits on our group for NHSE, often, will engage with us and collaborate on certain things. So, thank you very much for that. In terms of, we've spoken about, obviously, AXA members' innovation and technologies, and I know how much they kind of put back into research and development, etc. So how do you think their technologies can help the healthcare professionals of the future? And also, how can it help with the current workforce and NHS more broadly, do you think?
Yeah, such a good question. I mean, AXA does absolutely fantastic work, and with the NHS on this area, and really, really important is your relationship with our clinical stakeholders. And I know that that's there's a very, very close relationship in terms of let's make sure we get the clinicians round the table. So that needs to continue. I think staying abreast of the NHS priorities, especially we've got such a unique opportunity with the consultation that's happening over the following months that Wes Street in Secretary of State has launched at the party conference. And so your industry body and others will have that voice at the table to be able to continue to, in terms of innovation and technologies, to be part of that NHS reform. I'd say keep in touch with what we outline in our operational planning guidance for the trusts, because that's a really key document. And also carry on engaging on our pipeline. So we issue our pipeline, and as part of the Procurement Act, you're going to see even more pipelines coming out. So you'll know what the NHS, we're giving out very clear signals to the market, the areas that we're going in, what our clinical innovations and our clinical pathways need to look like, what our focuses are. And if you keep a look on the pipeline and what we're intending to buy and look at, it's a good way to start ensuring that your members are also talking about the same things, and we're all looking at the same things together, because I guess the biggest travesty is if the NHS are very clear on 5 or 6 priorities over there or clinical pathways, and yet the industry is working on other things because they're not going to align. So lots of information. I think it really is let's just keep communicating. That's how we do it. The NHS is your members, it is our suppliers, it is the 1.3 million people that work in the NHS, and it is all of our partners that make it possible. So but we've got to talk to each other. We've got to keep having that dialogue to make sure we're all going in the same direction.
Absolutely, and I think that's really important, that alignment. We're just going to slightly change kind of topic now. So I've seen, especially over the last sort of 5-6 years since I've worked for AXA, and we're seeing many more female leaders come into sort of positions within the NHS, medtech sector, etc. What can we do to ensure we continue to attract females into life science and medtech sectors, do you think?
So female and include actually any diverse characteristics, if you will. I want to work in a truly diverse workforce. So the most successful teams I've ever been in have had that diversity of every characteristic, diversity of thought, and not only is it really good fun, but we've been incredibly successful. So you asked specifically about females, so I'll touch on females. So I think there's a couple of things you can do. Number one, highlight female success stories, actually highlight any diversity success stories, but it's always really good. I think when women talent are looking at organizations to come and work at, they're going to want to see how are women flourishing, how, they want to work for those organizations that are going to value their contributions, and they're going to provide those opportunities for career advancement. So I think, highlighting their success stories is really, really important. And we do that a lot from a commercial perspective. And we showcase our female colleagues at all levels on International Women's Day each year. I think working with organisations that support women in the workplace is also really, really important. Again, and that's another way for really attracting female talent. So again, this is, I always, when I decide, wherever I'm going to look, I do look at, how is this company on certain scores, on their diversity and their inclusion scores. And we regularly engage with, for example, the Healthcare Supply Association and their women's network, and make sure that we go as NHS England, to these events and we support them. And I think finally, it's just make sure that we provide opportunities for growth and development. It sounds really cliche, but it really should be the mainstay of our business planning and our workforce planning, because that's how you're going to attract top female talent. Yeah, as a woman leader, you know, I'm just as ambitious as, you know, there's no difference between me and a male, or however anyone wishes to identify. There really isn't. We're all ambitious, right? We all aspire to get to senior roles. And as you go through your career, sometimes you need you need that diversity of an organization. You might need support in different ways, whether it's bringing up a young family, whether it's being a carer. There's a whole range of different support that is needed for our workforce, whether you're female, whether you're male, whether you're a carer, whatever, you know, with a disability, whatever it is. So again, I would say just encourage, you know, we've all usually got mission statements on these things and an E&I statements, but you've got to be really deliberate as an organisation, and you've got to be really deliberate as a leader to make sure these things are actually being put in place and you keep going and testing that it's working.
Absolutely. I think it's important that we don't just talk about it and we action it. And that's something that I'm really proud of. Over the last 6 years, we've seen so much more diversity within AXREM. Our executive committee, when I joined, I think there was one female. It's now more females, more diversity generally within the exec committee. And actually, that's really good, because I'm seeing that they're much more dynamic meetings, and, you know, there's more views on things, and we're making the right decisions based upon that. I just wanted to touch on and say congratulations on your recent award for the Chartered Institute of Procurement and Suppliers Leader of the Year. So I was just going to say, what do you think makes you a good leader?
Oh, thank you very much. I was absolutely honoured. It was an incredible honour, and it's a very heavy trophy. It's in my office at the moment because I just can't. You know, I'll probably leave it on the train or something. But it was by mistake. But I was to be recognised by the industry of which you're, you know, professionally accredits, by, you know, and to look out at we're at the Grosvenor in London, at those sea of, you know, over 1,000 faces and people that I've worked with throughout my entire career. I was very humbled. What makes me a great leader? You know, and I think I wrote an interview, if anyone's interested, on SIPS on this particular topic, if you want to go deep, but I'll give you some of the highlights. I mean, I think, don't wish to sound cliche, but be your authentic self. You know, when I first started work back in the 80s, it was very different. And I remember that I didn't, you know, I don't particularly look and sound like certainly not of a lot of female leaders at the time that I was looking at. And you know, I went through some quite interesting in early part of my career challenges. One particular bank I worked at, I was hauled in front of HR and told that my skirts were too short. Another bank said, "We think you're a real talent, Jacqui, but we need to send you on elocution lessons because your accent's too East London."
Wow.
And, you know, I've got a whole raft of things like that. And so, fortunately, whenever these kind of things happen to me, it actually usually just makes me fight even more, as opposed to sort of back down and think so. So my authentic self, and it's that saying, isn't it? You know, why do we spend our whole lives trying to fit in when actually we're all born to stand out in our own unique way? So that's gone a long way to who I am, I think. And then there's just a couple of things I'd say in terms of things that have been good, stood me in good stead. I mean, number one, learn from others. I constantly watch other people. I'm a bit of an impersonator in a community. I have had some horrible bosses over the years. I've worked for some shockers. I bet we all have, right? We can all say, and, you know, throughout my career, I've thought, I will not be that person. Never be that person. I will never manage through fear, through intimidation, through this false sense of superiority. So, you know, and I'd encourage everyone, just watch, right? Because you watch the bad ones just as much as you watch the good ones. Because, of course, I've also worked with some amazing people. I've got 3 or 4 people in my career who have not only mentored me, but I just learned so much from, and how to do it right. So learning from others. Again, that people first approach. We all say, "Oh, I'm a people person." But what does that really mean? It's that, for me, it's that affiliative style of leadership. It's about creating harmony, emotional bonds to build relationships. Yeah, I work in environments. Say I'm with these people all day long. I see my work colleagues a lot more than I see my family, and so I want to get joy out of coming in and working with them every day. I want to create that sense of harmony. Courage. We all need courage to do our roles. We've needed a lot of courage, a lot of us over the last 3 or 4 years. We've had to dig deep, right? It's been really, really tough, but don't be shy of calling things out. Don't be shy of doing what's right, even if everybody else isn't. Don't be shy of addressing issues head on. And I think just finally, my ethics and my moral standing, and I think we'd all say that. And again, it's about doing the right thing. So that, sticking to my values. And sometimes that can be really awkward. And sometimes you're asked to do things that actually just don't feel comfortable. And I, throughout my entire career, I've stood up and said no, or we should be doing it this way. It's always stood me in good stead. So I'll continue to do so. It seems to be working.
Absolutely. It sounds like it is. So congratulations again.
Thank you.
Right, so now on to my quirky question. If you could hang around with any famous person, dead or alive, who would it be and why?
Oh, I love that question. Really interesting, actually. And this is going to make me sound like, I'm not famous, clearly. Would have quite liked it if I chose a different career, but I'm really lucky. I've got a couple of quite famous friends, and I'm not going to tell you who they are, so don't ask. But it's really good fun, because when you do hang around with famous people, just how people react when you walk into a restaurant, you always get the best seats, and it's just watching people pretending they're taking pictures of themselves, but actually they're taking pictures of not me, but the people I'm with. So it's any of you who've got fame, and I'm sure many people on there do know people. It's an absolute blast when you do go out with these people. But for me personally, I've got a lot of role models, and big influential leaders. But the one person I really want to hang out with would be Stephen King, the author. I am a massive horror fan. I've read everything he's ever written, and probably every other horror book. I actually sit there on sort of Sky and Netflix and Amazon Prime, etc. And I struggle now to find a horror movie I haven't watched. So just go back and watch. Now I'm in the process of going back and watching all the old ones from the sort of the 60s and the 70s, which are an absolute blast. So he has always inspired me. What a storyteller! How does that man churn out those stories at the speed that he does and just terrify? He's terrified the whole world for over 40 years now. So I've always been in awe of him, and in my house I have a Stephen King bookcase, because I always insisted on getting everything in hardback. I don't think it's worth very much money, but I'm very, very proud of it. So I'd love to meet him one day.
Fantastic. And I'm very intrigued as to who your famous friends are now. So maybe you'll have to whisper that after we've stopped recording. But Jacqui, you're going to be the first guest that we've asked an extra quirky question to. And when we met earlier this year in Leeds, you happened to mention to me that you play the spoons. So when did you start playing the spoons, and what's your favourite tune to play?
Oh, fancy you remembering that. That's hilarious. Right, so let me explain about playing the spoon. So I was brought up in the East End of London. I probably got my posh voice on right now, but you should hear me when I'm with my friends. And it really was, back in the 70s, it was sort of down the pub singing around the piano, playing spoons, pearly kings and queens, and I'm very eloquent in Cockney rhyming slang as well. I could probably do a whole. In fact, I did deliver once a speech just purely in rhyming slang. So playing the spoons is an art form, right? But it's very easy to learn. Actually, if anything's got a rhythm and you can tap it out on the spoons, it's jolly good fun. I'm not going to give you an example, but I think I could probably accompany any song on the spoons. I should give it a go later on. But if people don't think they've got any musical ability, go online, find out how to put two soup spoons together in a knee. That's all you need.
Sounds like a challenge to me.
Yeah, I was going to say, and at least you have a posh voice. I don't have one, and I'm not even from London. Everyone thinks I am, and now people are starting to say they think I'm from Essex, but I'm from neither. I think I'm just common. So I'm glad that you've got a posh voice. I'm going to have to practice one. There's no such thing
as I think that we've got diverse. I mean, isn't that just one of the wonderful things about the UK? All the different, I'm really lucky. I travel up and down the country all the time, different hospitals, different environments and settings. And I just love, this is one of the things I love. For a very small island, how many different dialects we've got. It's absolutely fabulous. And so, never change how you speak. I think it's the richness, it's our DNA. It's great.
Thanks, Jacqui. So thanks for joining us today, Jacqui, and for your time. We've really enjoyed speaking to you, and we found out loads more about you and your role and all your plans at NHS Commercial. And a big thank you to all of our listeners.
Thank you. Thanks for having me.
Join Sally and I next week when we will be speaking to Andrew New and Richard Evans from NHS Supply Chain. If you have enjoyed today's podcast, don't forget to hit subscribe or feel free to share the podcast with friends.